What are exercise limits after skin removal surgery? After skin removal surgery, especially following significant weight loss and body contouring procedures, exercise restrictions are essential to ensure proper healing and avoid complications. The limits on exercise depend on the extent and location of the surgery but generally follow a staged progression over several weeks. In the initial phase, which lasts for the first 1 to 2 weeks, patients should avoid all vigorous exercise and any activities that significantly elevate heart rate. Light activities such as short, gentle walks around the home are encouraged to promote circulation and aid healing. Lifting, strenuous movements, and physical labor are contraindicated to prevent bleeding, swelling, and delayed wound healing. During the early recovery phase, which spans weeks 2 to 4, lower body exercises without weights may be permitted if they do not strain the surgical sites. Activities like bodyweight lunges and squats can be safe. Low-impact cardiovascular activities, such as walking, stationary cycling, and using an elliptical without arm involvement are generally acceptable. Upper body exercises, especially those involving arm movements or lifting, should still be avoided until cleared by the surgeon. Compression garments are often worn during this phase to reduce swelling and support tissues. Moving into the intermediate phase, which typically occurs between weeks 4 to 6, patients usually have a follow-up appointment around for weeks post-operation to assess healing. Surgeons may begin to clear patients for light upper body activity and gradually increase exercise intensity. However, heavy lifting, core workouts, running, and strenuous activities remain off-limits to protect muscle repairs and incisions, especially after procedures like tummy tucks or lower body lifts. In the later recovery phase, starting around 6 weeks and beyond, most patients can resume more strenuous exercise and lifting, but this depends on individual healing and the extent of surgery. For extensive procedures such as lower body lifts, lifting and strenuous exercise may be restricted for 6 weeks or longer. Exercise intensity should be increased gradually, paying close attention to any pain or discomfort. If pain occurs, activity should be reduced. Full return to pre-surgery exercise routines may take up to 3 months or more. Key considerations include the type of skin removal surgery, which influences recovery time and exercise restrictions. More extensive surgeries requiring longer healing periods and stricter limits. Temporary drains may be placed after surgery to reduce swelling and requiring careful management during activity. Individual factors such as medical history, medications, and healing response can affect recovery timelines. Patients should always follow their plastic surgeon's personalized recommendations and obtain clearance before resuming any exercise. Gradual progression and listening to the body are crucial to avoid complications like wound dehiscence, hematoma, or delayed healing. In summary, exercise after skin removal surgery is initially limited to gentle walking and low-impact activities, with gradual reintroduction of more strenuous exercise, typically starting around 4 to 6 weeks post-operation, depending on the procedure and individual healing. Full return to normal exercise routines may take several months, emphasizing the importance of surgeon guidance and patient caution throughout recovery.